Hey everyone, how are we doing today? My name is Eric Speck, the VP of Ethics and Support at RPH Ally. So I'm back again today after taking a week or two off. Life has been busy, but that's how things get. Everything's good, and I'm glad to be back to deliver you another video, chapter 5, about my wild journey through pharmacy. Chapter 4, the other week we talked about how I went to a treatment center but was unsuccessful because I didn't know what I was in for. I did not know opiate withdrawal would kick my butt that hard and for so long. So I was not prepared for it. Yeah. And so I left and I headed back home. So we're going to find out what happened when I headed back home right after this. All right, very cool. So I was trying to adjust my screen here. I don't think I could do it when I'm recording like this, so apologize for that. Not too tech savvy apparently, but I headed home, right? So I'm going through withdrawal. It's been about 2 weeks, probably a little bit more, feeling absolutely miserable. Just want these feelings to go away. Felt that the treatment center wasn't doing it for me. My mind was going crazy. I just need out of here. So that's what I did. Headed home, drove about 2 or 3 hours back to my residence. And, maybe surprisingly, maybe not surprising, depending on how well you know addiction and addicts. But I had a stash at home and I immediately went there and started using to make those feelings go away. But if you've been following along in this story, you know that I no longer have access to pills. So I was going to be in a lot of hurt really, really quick once I ran out. And I know I needed to do something. That's why I went to treatment the first time. Like, I don't have access. I want to go through this terrible withdrawal. I want help so I can be supervised and they can make the withdrawal symptoms a little bit worse. I don't know, something to help out. I just didn't want to do it alone. And I knew I was going to be in that situation again alone unless I found help. So I don't remember exactly how I found this particular treatment center. I probably used Google and looked at places in my area. And I found a really good facility where they had an outpatient program and they treated opiate patients with Suboxone. And even being a pharmacist, I obviously I knew about Suboxone. I know what it was used for. I don't know why I never included it in my plan for treatment for me in the future. I mean, honestly, guys, I think going through addiction and opiate withdrawal, I mean, clearly your brain's not working right. You're not thinking right. You're not making the best choices. You're not thinking about the best options or what options are out there. It really just full on survival mode. But this time I realized it did Suboxone and decided to go that route. So when I first got there, if you're familiar with Suboxone, you can't take it right away because it could precipitate a withdrawal, right? So they need to get most of the opiates out of your system before you take the Suboxone. And I believe they said 5 days. Like, Eric, don't take anything for 5 days and then take the Suboxone. Well, I made it about 2 days, and I'm not very good with withdrawal, as you guys can tell. I think I'm a big, tough, strong dude, and I am, except for when it comes to this stuff. Like, it knocks me on my butt. I'm no match for it. So after about 2 days, I'm hurting, barely get out of bed, barely function, barely think, anything like that. And so I said, I'm just going to take the Suboxone and see what happens and hope for the best. And fortunately, guys, I took it and it worked. It felt great. It gave me this relief that I haven't had in months, like since I tried to stop using opiates. I felt largely normal again. I didn't feel tense. I didn't feel anxious. I didn't have those racing thoughts. I essentially felt like normal, like myself in a lot of ways. And it was a huge relief. One of the best things about it is the worst thing about withdrawal I mentioned before for me is the insomnia. When I can't sleep, my legs are kicking, I'm thrashing around in bed. I was able to sleep just fine. Drug works great, just as it was supposed to. That's why you hear all the time people say, Suboxone saves lives. Um, it really does. It is a pretty amazing drug. Not perfect, not a miracle drug necessarily. A lot of people may say it is, and I guess in some ways it is, but it's not benign, it's not perfect. And I'll talk about that later when I talk about when I decided to get off it. But for the time being, I was in a much better place. I continued to go to the outpatient treatment, multiple days a week, doing the urine drug screens like that, and things were going really well. And now that I got a little bit of stability in my life, I needed to figure out how to get my career back on track. And now that I was in a place where I felt I was able to do it, that's what I pursued. It didn't take long before I got a job at a chain pharmacy really close to where I live. And they, did the urine drug screen. Suboxone doesn't show up on the urine drug screen. At least it did it on this one. I don't think it does on most, maybe unless they're specifically looking for it. Kind of just information for you guys. And to stop there briefly, I think the drug tests are designed to catch people who are using illicit substances or they're maybe abusing prescription medications and not using them as prescribed. Maybe they're not prescribed at all. So that's why we're testing for them. But for somebody on Suboxone, that is for opiate treatment largely, very much most of the time. And why would we want to test for that? It's not like somebody's taking that to get impaired, although I have heard some people abuse it, but it's really not the point of a drug test. I think if we start disqualifying people from jobs and things like that because they're taking Suboxone, then we are creating a big barrier to these people getting the treatment that they need, and that would be a bad thing. So bottom line, I'm happy they don't test for Suboxone in urine drug screens, not just for my sake to get this job as a pharmacist that I really, really wanted, but just in general, I don't think they should be testing for that unless there's a specific, situation where a provider wants to see that. And so, yeah, started working as a pharmacist, taking Suboxone. Things were fine. I felt just like I was before. I didn't feel impaired at all. Recently, I was approached by a pharmacist who saw a report that came out where they actually were talking about not allowing pharmacists in treatment to go back to work while they were on treatment with Suboxone because it resulted in impairment and it could jeopardize patient safety. And so I had a great conversation with this person and talked about my experience. And I don't think I was impaired at all by taking Suboxone. I was impaired when I was taking, Schedule 2 opiates, Schedule 3 opiates, which was, Norco at the time. I mean, definitely, those medications get you high, and that's why I was taking them. And along with that is impairment. But the Suboxone doesn't get you high, and it also doesn't result in impairment. In fact, when I was working as a pharmacist while taking Suboxone, I got the best compliment I ever could have got as a pharmacist. And I shared this experience with this individual I was talking to about the pharmacist on Suboxone, where she said I was the best doctor she's ever had in her life. And she was elderly, let's say 80 years old. So she's probably seen a lot of doctors and a lot of pharmacists. And here I am, pharmacist, taking Suboxone, working through my addiction, early in my recovery, and I got like the best compliment you could ever get. So I know that's just a very small sample size of one guy, maybe one instant, but if Suboxone was impairing my ability to become a pharmacist, I probably would have got a compliment that I was the best pharmacist the patient ever had. And yeah, so I think that's good evidence. That's good support right there. And I worked for months taking Suboxone on my maintenance dose. Everything was just fine. I did want to taper off my Suboxone because while Suboxone did a really good job at allowing me to function as a pharmacist, to function in life, to make sure I didn't go through those withdrawal symptoms, so I didn't have those really low, depressive episodes, that anxiety, that worry, that fear, everything that I was experiencing before when the opiates would start to get out of my system. I didn't have those low points, but for me, Suboxone made it so I couldn't experience those really high points. Like I would go do fun things with friends and family, and it wasn't enjoyable for me. It was just a very numbed out experience. Like, for example, I went to Hawaii when I was taking Suboxone, and you think Hawaii, it's my first time ever there. You think it'd be a very enjoyable experience, but I really didn't enjoy it at all. And it was really depressing and sad because I knew I should have been enjoying it. I should have had that happiness, that excitement, everything that goes along with it, but I was just very numbed out. And I'm not saying that Suboxone affects everybody this way. It might, maybe to different extents to different people, but for me, that is definitely how it affected me, and I didn't like it. So I worked with my provider to taper my Suboxone because I eventually wanted to get off of it. That was my plan. He was in agreement with that. And we started to taper the Suboxone. Coming off Suboxone is difficult. If you compare it to ripping off a Band-Aid, it would be the slow version, taking a Band-Aid off really slow. Coming off a short-acting opiate like oxy or hydrocodone, hydromorphone, uh, fentanyl, heroin, I imagine, is more fast, intense withdrawal. So that's going to be like ripping off the Band-Aid really fast. And you ask people, what's better? Do you want it ripped off fast or do you want it ripped off really slow? I tried the really fast way before and I couldn't get the Band-Aid all the way off. So this time I said maybe the slow version is going to be better. So we started to taper Suboxone and rip that Band-Aid off really slow. It wasn't necessarily enjoyable. I still started to have a lot of the insomnia that I experienced before. Still have a lot of the sweats, a lot of the tension, but it wasn't nearly as bad as my previous experience trying to get off of the short-acting opiates. I'm going to leave it here just because the next chapter, I'm going to go into some really bad experiences that I had with drawing off Suboxone and how we tried to remedy those symptoms and how I had some, we'll call them adverse drug reactions that led to some pretty incredible events, and not incredible in a good way. So guys, tune in next time, talk about what happened. If you have any questions about Suboxone treatment, why go that route versus another route, anything about my experience with it, be more than happy to help you. And guys, again, that's why I do these videos. It's like talking about, the worst time of my life. Why would anybody want to come in here and do that? Well, I don't do it because it necessarily makes me feel good. Fortunately, I've, been in recovery for a long time. I've done a lot of work on myself. I've healed a lot. I've grown a lot. So I'm strong enough to be able to talk about these experiences now. But ultimately what it's for is if somebody's watching this who needs help in this area or knows somebody who needs help in this area, or a similar area, I want to be able to share my story so you can relate to it. And I'm here to help. I don't want all of these bad things that happened to me to have happened for nothing. If I could take that really bad experience, the wisdom I gained, the lessons I learned from all of this, and help people going forward, then that will make it worth it. I'm going to use that, maybe not completely worth it, but it'll make it better versus not being able to use any of those bad things for good in the future. And the only way I'm able to do that is by sharing this information with you and a lot of these details. So guys, I'm here to help any way that I can. If you want to reach out to me, you can find me on rphally.com over at the peer support channel. You can comment below this video or message me directly. You can also check out my website at ericjspeck.com. I almost forgot that. It's my name. That's silly. All right, guys, we'll talk to you later. Thank you.